Asthma is a serious condition that can make it hard to breathe. There is no cure for asthma, but it can be managed by taking medication as directed by a doctor. This Asthma Quick Take will tell you about inhaled asthma medications. At the end of this presentation, you'll find helpful downloadable resources. There are two main types of inhaled medications that help to manage asthma symptoms: controller medications, sometimes called preventer medications, and quick relief medications, sometimes called rescue medications. Controller medications work over a period of time to help prevent asthma symptoms from occurring. They're taken at home every day as directed by a doctor. They should be taken even if the child feels fine. After taking controller medication, the child should always rinse with water and spit, not swallow or gargle. This will help avoid thrush, an infection of the mouth and/or throat. Quick relief medication helps to stop asthma symptoms after they start. They should be taken at the first signs of asthma symptoms, both at home and at school. Quick relievers reduce symptoms for 4 to 6 hours. Exercise can also cause asthma symptoms. In this case, the doctor might recommend that a child take quick relief medication 15 to 30 minutes before exercising. This can help prevent asthma symptoms while exercising. To keep asthma under control, the right medication must be taken at the right time. To avoid confusion, have parents write C on the controller medication and QR on the quick relief medication. If parents are unsure about which is the controller and which is the quick reliever, their doctor or pharmacist can help. The metered dose inhaler, or MDI, is the device used to deliver quick relief medicine. It produces a mist that is breathed in. Before a metered dose inhaler is used for the first time, it must be primed to ensure that the right amount of medicine is delivered. The inhaler must be primed again if it hasn't been used in 14 days or more, or if it's dropped. To prime the inhaler, take the cap off the mouthpiece and shake the inhaler well. Then spray 4 puffs of the medicine into the air, away from your face. Not all inhalers are primed in the same way. Review the instructions in the inhaler box to be sure that the inhaler is primed correctly. When using the inhaler, the medication should be inhaled deeply into the lungs. Using a spacer with the inhaler, like the one shown here, will help deliver medication more effectively. To use an inhaler with a spacer, shake the inhaler for 5 seconds and insert the mouthpiece into the spacer. Breathe out all of the air in the lungs. Place the lips tightly around the mouthpiece and spray 1 puff of medicine into the spacer. Inhale the medicine with a slow, deep breath that lasts 5 seconds. Then hold the breath for 10 seconds. Breathe out slowly through pursed lips. If 2 puffs are prescribed, wait 60 seconds before taking the second puff. If a child is in distress or is too young, school staff will have to prime the inhaler and help the child take the medicine. Sometimes the inhaler gets clogged. If this happens, check the inhaler instructions or website for directions on the correct way to unclog the inhaler. Also, wash the plastic spacer tube once a month with warm water and dish soap and let it air dry. Each asthma inhaler contains a specific number of puffs. Most inhalers have counters showing how many puffs are left. Don't use the inhaler when the counter gets to 0. The medication is gone. School staff should ask the parent to order a medication refill when there are about 20 puffs left. If the child's inhaler doesn't have a counter, the parent can ask the doctor to prescribe an inhaler that does have a counter. Like all medications, asthma medications have an expiration date. To ensure that the child always has medication on hand, parents should refill prescriptions before they expire. If no refills are left, parents should ask their doctor for a new prescription. Controller medication should control asthma symptoms. An easy way to tell if symptoms are under control is to use the rules of 2. Just answer these questions. Does the child have asthma symptoms or use the quick relief inhaler more than 2 times a week? Wake up at night with asthma symptoms more than 2 times a month? Refill the quick relief prescription more than 2 times a year? If the answer to any of these questions is yes, then the child's asthma is not under control. The parent should contact the doctor. The child might need to take the medication more often or might need a different controller medication. The parent should not stop or make changes to the child's medication without first talking to the doctor. In order for a child to take medication at school, California law requires the school to have on file a medication authorization form signed by the doctor. Also, California law allows a student to self-carry and use the rescue inhaler at school if the parent and doctor provide written permission to the school. An asthma action plan is an important tool. It tells how to recognize asthma attack symptoms and how to respond, including which medication to use and the correct amount. A new asthma action plan must be completed and signed by the doctor each school year. Parents should take copies of the plan to every doctor appointment. You can download this asthma action plan at the end of the presentation, or parents can get an asthma action plan from the doctor. These are downloadable 8.5 by 11-inch documents that will help you to use asthma medications effectively. This poster shows you how to use an asthma inhaler and spacer. A second poster shows you how to use an inhaler if there is no spacer. Print copies and ask the child's teacher, front office staff, and nurse's office to post them, and ask parents to post copies at home. Next is an asthma medication school authorization form that must be completed and signed by the child's doctor and parent and kept on file at school. A new form must be completed each school year. This is an overview of the California medication self-carry law. Next is the asthma action plan described earlier. It must be filled out and signed by a doctor. Copies should be kept at school and at home. The plan shown here also includes a medication authorization section, which eliminates the need for a separate medication authorization form. Last are the rules of two that let you know if the controller medication is keeping the child's asthma under control. To download these documents, click on the links associated with this video. If you are not viewing this video on the CHAC website, please go to chac.org to find these and other valuable resources. Thank you for viewing. Please view our other asthma quick takes to learn how to manage asthma effectively at school and at home.